Hi, this video will be addressing the two components of your skills validation, which will be TED hose, one name for them, elastic compression stockings, another name for them. A physician order is required for these. The other component will be what we call SCDs, or sequential compression devices. Both of these items or interventions are intended to prevent the patient from developing blood clots. So patients that you will see typically needing these things will be patients that are not very mobile, whether it's for a long-term period of time or maybe it's an acute period of time, for example, post-operatively after someone's had a surgical procedure. So there will be an order for both of these. Usually they remain on and we take them off for things like showering, or we may take them off at night for your patient that wears them long term, and we can wash these out with water and soap in the sink and leave them hang out to dry. Sometimes these SCD sleeves tend to make the patient's legs warm, so they complain, so we'll give them some intermittent times where we might give them a little break. With the TED hose, we're going to be putting them on Mr. Smith. Mr. Smith, we're going to be putting your TED hose back on for the day because I know they had taken them off to give you a little bit of a break, but we're going to put them back on. We're also going to put your SCD sleeves on because we want to prevent you from getting any kind of blood clot. Just be careful when you get up. You always want to wear slippers or some kind of shoe that has a gripper because these can be very slippery for patients when they walk on the floor with these. So of course I would educate Mr. Smith, and Mr. Smith is agreeable. He wants them back on. These are what we call thigh-high TED hose. Many times we just have knee-high TED hose for patients. So it depends on what the physician wants and what the provider orders. Just know that they're one size fits all for the lab mannequins. However, in real world situations, when you get out there and you're in the clinical setting, you will be measuring patients. You'll be measuring the diameter of their calf, and you'll be measuring the length of whether it's thigh high or whether it's knee high, because there's different options for sizes, okay? With the TED stockings, you'll also see that there's an opening so that we can check circulation within the toes, okay? Cap refill, circulation. I know Kim has done a great job of teaching you that in physical assessment course. If patients wear these at home for compression and to help with circulation in the legs, you'll notice that many times they don't have holes in them. But in the acute setting and long-term care setting, many times you'll see that they have the holes. So you're gonna take it just like you would socks at home. You're gonna gather the sock up in your hand. I do not need gloves because I do not anticipate at this time that I'm going to come into contact with any blood or body fluids. But if your patient happened to have any open areas, sores, wounds, where there was any kind of drainage, then yes, I obviously would wear some gloves. So I'm gonna gather this up. I'm gonna start by putting it over the patient toes, and I will tell you that these are not always the easiest things to put on. You will see in the agencies that they have assistive sleeves with almost like a slider material to help get these on. That can be helpful. I've used a trash bag before, putting a trash bag over the patient's foot first, a clean trash bag of course, something slippery so that these socks can go over, okay? Once you kind of get it past the heel, let's hope Mr. Smith's mannequin leg cooperates here. I'm sorry, Mr. Smith, I know this is a little bit uncomfortable, but we'll get these on as easy and as safely as we can. And so if these are thigh high, they're gonna go up to the thigh, okay? If they're knee high, they would have went up to the knee. The goal is, we know that the mannequins are a special population, and we know that it may not be as easy for you to get the wrinkles out. But the goal is, just like, you know, if you were wearing socks or stockings at home, you would not want to have any kind of wrinkles in the socks. So the goal will be for you to try your very best to get the wrinkles out. But see, you can see how we can check circulation in the toes with these. Okay, not too tight, not too loose. You want to compress the leg to help with circulation. So our TED hose are on. Of course, I would verbalize that I would make sure to try to get all the wrinkles out of there that I could. And then I take my SCD sleeve and I'm going to unvelcro it. They look differently depending on the manufacturer and the brand. They can be white, they can be tan. They can also just go on the foot. These ones are going to go, you know, along the calf. But you would put this here. Be careful of this hose because it can cause a pressure ulcer on the heel or on the side of the foot if we cause it to be too tight or put it against the bottom of the foot. So you're going to place this along the leg, okay? And then you're going to Velcro that right across the leg. You know, just enough so you can get it, you can still get your finger underneath so that it's not too tight. And then you will take the hose that comes along with the SCDs and hook it up to a machine that you'll see that's usually at the bottom of the bed, and you'll turn it on. And what it does is it deflates and inflates so that there's some circulation, okay? Sequential compression devices. You'll see it compress and then it will deflate. It's almost like a little mini massage for patients, and it's just to stimulate that circulation as a preventative measure. So there you have it, TED hose and SCDs. Thank you.